the next hour and a bit is give you a lot of practical clinical information. It's not a talk on research, but it's based on research into pediatric sleep disorders. And so the main aim of my talk is so people will be familiar with what wakes up children from sleep, what disturbs them from sleep. And I know this is actually, it's an interesting organization. Everyone's interested in craniofacial pain. I'm not going to be talking about pain, but when parents come and they say, you know, my child's waking up, I think it's pain. There's so many other causes that you have to be aware of so that you can actually figure out when to refer a child to a medical specialist, when it might be pain, but more importantly, what we're going to talk about is when it's not pain. What do you think contributes to children not getting the sleep they need? I told you already about technology. Do people have other ideas? Diet? Okay. What about diet? What in particular?
Sugar.
Sure, so all the caffeinated products, you know, we didn't, when this audience and myself, when we were growing up, we didn't have Red Bull, you know, we had Coke, but we didn't have a Starbucks on every corner, so for sure, caffeine is also. So one of the other things that makes us sleep less in 2011 is environmental. So our sleep cycle is very triggered by light and dark. This is just a picture from the internet of what the Toronto skyline might have looked like in, let's say, 1940. This is a picture of the Toronto skyline in 2011. Obviously, you can't compare the pictures because one's not in color, but you can imagine that there's just so much more light in society than there was 50 years ago. So this is another picture because I want to show you that there's a big variation from one person to another. So often parents will say to me, you know, how much sleep does my child need? But the question isn't so much how much sleep does a child need, it's how are they functioning on the sleep they're getting. So if a child sleeps less or more than normal, but during the day they're doing well in school, they're not falling asleep, they're not irritable, they're not hyperactive, they're probably getting enough sleep. So I think this nicely demonstrates, it's a graph from pediatrics, from an older journal, 2003. But you can see that at the age of, let's use this, about 3 months, here's sleep duration. From the 3rd to the 97th percentile, it actually goes from 9 hours to 19 hours. So we can say like the average 3-month-old will sleep about 14 hours out of 24 hours, but you can see there's quite a big spread, and that's all considered normal. It's all within the normal curve. Whereas when you get towards adolescence, so here would be a 15-year-old, you might have from 6.5 to 10 hours of sleep, but obviously the children who are sleeping 6 to 7 hours are probably not getting enough sleep. I'm sure people know that sleep disorders are quite common, which is, thank you for inviting me because you want to know more about it. So we all know that 20 to 40% of parents, just parents who are in a physician's office but not for a sleep problem, just coming for routine care, and this has been repeated on many survey studies, will complain about their children's sleep. Sometimes the pediatrician and family doctors don't ask about sleep, usually because they don't have time or they're not sure what to say when the parent, you know, has a concern. But if you ask, parents will definitely complain about sleep. I don't know, in your dental practices, would it be common to ask parents about their children's sleep? Yes? Okay, good. So what wakes toddlers from sleep? So we're going to get back to why I showed you that ultradian cycle, because the most common cause of sleeplessness in a child is behavioral insomnia. So behavioral means it's not due to teething, it's not due to pain, it's not due to, you know, otitis media, it's not due to sleep apnea, although all those things can also be considered, but it's due to the child having trouble settling at night, waking at night because of behavior. So this is just a little comment. It says, come on, don't think of this as going to bed. Think of this as a short break between nighttime naughtiness and morning mayhem. So hopefully parents aren't saying that.